Hi everyone, how are you guys today? I am Dr. Ricardo Alves from Brazil. First of all, I want to say thank you to the Geistlich company and to the whole people who were involved in my invitation to the Geistlich plus you in the spotlight. I'm very honored for being here. Today, I'm going to present to you guys a dental case about a patient who suffered a bike accident. We're going to talk about GBR plus immediate dental implant in a patient victim of trauma. This is the first picture from the patient when he came to my dental office. At that moment, he still had some stitches in his mouth, and I was told that he was victim of a bike accident couple days before. So we ordered image exams to make a plan, and we have the right diagnostic from this case. This is another view from the patient. And here, after the examination and also this first image exam that I got, it was the X-ray, we noticed that the patient lost a dental unit, the 21, and also had two broken teeth, the units 11 and the 22 as well. Here another view from the occlusal view from the tomographic exam. We noticed by the tomographic exams that the other units were in a good situation. Only these 3 units had damage. Looking to this picture, you can see that there is a fracture on the buccal bone. Checking it, we noticed that it was already involved by the soft tissue, so we considered it was already lost. The good news was that the patient still had a good amount of bone on the palatal area. Following the classification of this study from Ken et al. From 2011, we classified the situation of this patient as type 1 in this classification because type 1 is when we had enough bone on the palatal area that we can still put the dental implant in a 3-dimensional position, even that we lost completely the buccal bone. This was the situation at the moment of the surgery. Even with all the damage that we had, we could see some good situations in some points. For example, we still had the papillas, we still have a good height on the gingival margin, but the bad scenario was that the buccal portion of the soft tissue was invaginated to the bone defect. So we started the surgery. You can see that we stood away from the papillas on the both sides, and then we cleaned it up everything inside the bridge, and so we did the toilet. And then we started the perforation looking for the three-dimensional position, the best position that we could to this dental implant. This is the post to check the position. Here is a occlusal view, and in this view we can see the portion of the bone that we have to rebuild. So we started the installation of the dental implant. See that this dental implant has a good design, a good shape, so looking for primary stabilization. And here another view, closest. And because the surface treatment of this dental implant, it's a very interesting that once the dental implants touch the blood starts to coming up to the body of the dental implant. Here you can see better. And this is a very interesting. You see all the blood coming up, and this is very good to the osseointegration. A closer view. Once the dental implant is installed already, so we start to look for the margin in relation to the dental implant. So we proceed the measures because we have to make sure that the dental implant has a good distance from the dental margin, at least 4 millimeters from the dental margin, because it's necessary this space to regrow the soft tissue between the permanent crown and also the dental implant. So we checked the dental implant was in a three-dimensional position. Also, we see in this picture what that we have to rebuild, talking about the bone defect. So we started to proceed the GBR using biomaterial, using the BIOS. I have chosen the BIOS large because the size of the bone defect. In this picture, you can see the shape of the particles of the BIOS large. And then we use a very good membrane to cover it. And this is the BioGuide. So I decided to cut the BioGuide to cover all the area in a better way. This is another view from the BioGuide membrane. Then I collected a soft tissue from the palate area. And then we put over the BioGuide membrane. And then we started to do the stitches, and we use absorbable and non-absorbable tissue stitches, sorry. This is a very good picture that we can see all the volume that we got in at the moment of the surgery. It's a very good amount of volume. So at that moment, I saw that we have a very good situation, a very predictable one. So we did the temporary crown. This picture was taken 12 days after the surgery. We can see no signs of inflammation or sore, and the patient had no complaints about the recovery time. Then we redesigned the temporary crowns, and after it, the lab sent us the permanent crowns done. We can see other views from them. This picture is very interesting because we can see that the volume that we got is still there. And on the left, we see the prep to the crown, and on the right, we can see the area of the dental implant ready to wait for the permanent crown. Here, the crowns already set on the place. This is an amazing picture, a beautiful picture that we can see all the treatment done, our job that we put our efforts to do well paid. That's very important to remember that we had the right plan since the beginning. We had a very good surgery, and very important is that we used the right materials. We used a very good dental implant and also excellent biomaterials. We used BIOS and BioGuide membrane. In this case, in this scenario, we had, since the beginning, a very predictable treatment. And look what we got. Then, finally, we have the new smile from the patient, very secure smile. Here again from another angle. And this is a very happy picture. The patient was very happy, and the feedback was excellent for us. A very emotional feedback from him and from his family as well. Here another picture. And finally, guys, I want once again say thank you to the Geistlich company, and also thank you for your audience. I really hope to see you guys very soon. Stay safe, and greetings from Brazil. Bye-bye.